So I'm about to spill the tea on my tummy tuck. So let's get to it. Now tomo mi tecito. Que por cierto, you're going to be needing your tea. Arnica tea. I am 1 year post-op from my mommy makeover. If you've seen my other videos, if you know, you know. For today, we're going to be talking about my tummy tuck. So what is it that happened? My before and my after. So my tummy tuck was a combination of muscle repair, because I did tear my muscle, my ab muscles, mis abs, liposuction on the upper part of my abdominal wall, the upper part of my stomach, and on the sides. I did not get lipo 360, which is basically when you do lipo 360 is all around. I did not get that with my tummy tuck. Getting rid of my excess skin, because let me tell you, it was a lot. I have 4 pregnancies, 4 babies, and whenever I got pregnant, I did not make little bellies. My bellies were massive. My bellies were so big that I was not able to hold my hands together to hold my belly. So since baby number 1, it's always been like that. So after I delivered my babies, I would go back to my regular weight, and even then, I still had a lot of excess skin. And if somebody comes at you and says, oh, all you got to do is just work out. No. False information. Or, oh, well, you just need to wear cream when you're pregnant. Avoid all that. You could avoid some of the excess, but you're still going to be left with skin. Maybe not as much as me or as other people. It just depends. Every human, every woman is different whenever she has her baby. Some go straight back to exactly the way they were. Others do not. And in my case, I did not. Even after baby number 1, I still had a lot of loose skin. It was basically, I was always so shy to show anybody, but the way that I would describe it is like if my belly, just this circle right here, would expand, because I didn't really get a whole lot of stretch marks on the side. It was just this circle, this big little circle, like the size of a dinner plate of wrinkly stretch marks full of skin. So I was not happy with it. And for that reason, I got a tummy tuck. And I just kind of want to go over where my scar is. So I did get a brand new belly button, brand new. And my scar, with my doctor, is Dr. Tanisha, like you've seen on all of my videos. Dr. Tanisha is where it's at. His incisions, he does them really, really low. So if you're wearing a bikini or even just underwear, you would not be able to see the incision. And the belly button is not super high up that it looks weird. It's positioned at a really good spot. And yeah, he just did an amazing job. So once, I need to stop saying so. Take a shot for every time that I say so. So day number 1, once you go in, he's going to mark you up and be like, we're going to take this much, this right here, over there, blah, blah, blah. He does all the markings. Once you go in, they'll show you how much excess skin they're going to take off. Once they draw you up, it was literally my skin that started from up here to down here, all this gone. So they basically, this is what they do. Stick it back together. Oh, and of course the muscle repair and all that good stuff. Once you get out of your operation, I highly recommend to stay wherever you're going to get it done. Staying there the day before, of course, your surgery, the day of your surgery, and the next day. So staying there for a few days would be ideal. If you are coming from out of the United States, they do recommend staying a little bit longer only because you're not able to fly. That's something that you need to talk about with your surgeon, is how much they recommend, because every doctor does have different requirements of how long they need you to stay. In my case, since I'm still in California, I did not take a plane. I was able to leave the day after my surgery. So basically, I went in the day before. We kind of went over everything, what they expect, what I expected, and what I needed to do to prepare for my surgery. The day of, I came in, they did all the drawing of how it was gonna happen, and it was early in the morning, and by like midday, mid-afternoon, I was out. Like, I stayed at a hotel that night. And then the following day, we did meet up with the doctor again. He checked me, make sure everything was good, and gave me the clearance to be able to drive back. Just so you know, your pain isn't like at an all-time high where you feel like you're like dying and that you're going to be driving back home in a lot of pain. Not really. On our drive back, I was actually feeling pretty well, pretty okay. I'm not gonna be like, oh yeah, I feel great. No, I really not like that. But I didn't feel horrible. The only part that was kind of horrible is like when you need to get down to go use the restroom. You're walking hunched over because you cannot stretch. So you're walking hunched over, and people are just looking at you like, what is going on? But that's mainly like, that was literally like the only thing that was uncomfortable, because once you sit down in your car, as long as you're keeping your legs at an angle, you're not really going to feel any pain down here. The first 6 weeks of your surgery, you are not going to be able to stand up straight. Now, there are some people that go other places, that not with Dr. Tunisia, with other surgeons, and they're like, oh, after a week or two, I was able to walk straight. In those scenarios, I would be very concerned, because then that just means that they didn't take off a lot of skin, because you're able to stretch it out. With my doctor, at least in my case, he took off the most skin that he was able to do. So when I got out of there, I was not able to stand straight for almost 7 weeks in my case. So by week 6, I was able to stand straight, but then after a while, I'm like, okay, I need to bring it down. Let's take a sip. Cheers to a speedy recovery. Some tea at night or before you go to bed. Yes. I do have my notes. I wrote down notes so I don't forget. There's some things that I forgot to mention about my other surgeries, but I guess I'll just I'll make more videos about it. If I do forget to answer any questions, because I have had people send me messages like, hey, talk about this, or what about this? If I do forget to answer some of the questions, ask me again, and I do want to continue making a lot more videos about this. Anyways, let's go back to day 1. Once you get your surgery done, you will be going to your hotel. Because my doctor, he is like 6 hours away. Once we got to our hotel, I literally do not remember any of it. I just remember laying down, and then waking up wanting to go use the restroom. When you wake up for the first time, to get up after a few hours of sleepy, and you're like, I feel great. No me pasa nada. No pasa nada. I feel great. My husband, I remember he was like, stand up slowly. Do you feel good? Do you feel okay? And I was like, no pasa nada. I'm good. I literally walked over to the toilet. I used the restroom, and as I was sitting there, I was like, oh my goodness, I'm gonna faint. I'm gonna pass out. I just remember like hearing his voice very distant. I remember it almost sounded like staticky. Like his voice was very staticky and it was coming in and out. And I told him, I'm gonna faint. And then he's like, let's get you to the bed. And as soon as he laid me down, I was just thinking, like, give me something, like something sweet. It feels like your blood just goes all the way to the floor and you're like feeling dizzy. And luckily I had this little container. Well, not this one exactly, but when I take honey around, I always put them in smaller containers, so I'm not carrying the big ass thing. Luckily, I had one of these for my tea, because I did start drinking my arnica tea a few days prior to my surgery, and luckily I had this. And I told him, give me a spoonful of honey, because we didn't have any candy there. So he gave me some honey, and with that, it's like he brought me back to life. Do not get scared when you first get out of bed to go use the restroom and you start feeling lightheaded. Do not call 911 unless you do fall and faint. Then yes, call 911. But if you just feel like you're sweating cold and you're kind of going in and out, just lay down, take some honey, or if you have a candy, or if you have Gatorade, take a sip of Gatorade. I had Gatorade. I did have a sip of Gatorade, but I didn't feel like that didn't do anything. That's why I had told them, get me some honey. And with that, oh yes. They don't really want you to be doing a whole lot of walking, but they do want you to move. So on day one, they're gonna tell you, just kind of try to move your legs a little. And if you could walk like in a small circle and then lay down every few hours. Same with day two. They don't want you walking around a whole lot, but you do need to move. So move. Do not just lay there, especially your whole 6 weeks. You do not want to just be laying there waiting for all the stitching to recover. No. You need to move around. You need to get that blood flowing, all right? You're gonna have like a cocktail of medication, but all that your doctor will go over. I'm not gonna tell you specifically what kind of medication I took, because I know every doctor has different protocols, but you will have a handful of medication. So do be aware of that and make sure that it doesn't interfere with other medications that you're taking. But of course, like I've said before, I am not a doctor, I am not a nurse, and I am not a specialist. This is just my experience of what I did, what I went through, and what I felt, and what I took. That's it. It's just my recommendation because I went through it. It does not mean that this is what you have to do. Okay? Okay. Another thing, I always say another thing, and I always say so. Your body will have bruises. That's one of the things that I wasn't expecting in some sense, because I knew there was going to be blood. I knew there was going to be an incision, but I wasn't expecting the bruising. There is a lot of bruising, so be aware of that. Once you see your body for the first time, you're like, ugh. So there is bruising all on the side, mainly when they do the liposuction, which is, in my case, was right here, and some on the side. What else? And bruising, they do say that it could last between 3 to 6 weeks, but it's different with everybody. Everybody recovers different. Everybody heals differently. I mentioned the pillow. These pillows, I mean, you don't have to buy these specifically. You could just use extra pillows, like regular pillows in your bed, just to elevate your back. You do have to elevate your back, and you have to elevate your legs to kind of create this angle. You can't put your legs straight when you're laying down, because you can't stretch your incision out. So the number one thing is, do not stretch out your incision, because it's basically like closed, right? It's healing to seal, but if you're stretching it, it's gonna start making your scar wider, and it's gonna start creating like tissue damage, and then it becomes like a little border. I don't know, whenever you do your research, or if you know of somebody that's had it, sometimes their scar ends up being wider or ends up feeling kind of bumpy. And one of the reasons, I know there's more to it, but one of the reasons would be that they were stretching it out too much, and it created kind of like if you're just separating your skin, it's creating tissue right there, and it ends up being super thick and bumpy and not good looking. So if you want to keep it very thin, very cute looking, do not stretch out your legs, and do not stretch or try to walk straight too quick. You do need to give it time to heal. So these pillows right here, I highly recommend because they let you sleep a lot better. They feel very comfortable and they don't slip. And I don't know, with pillows, I didn't really try it because I didn't use pillows, but sometimes they do move around. And these, the material that they're made out of, they don't move around. So I do recommend these. Another thing that I do recommend is buying a walker. Yup, you heard it from me. You're gonna need a walker. Why a walker? Well, Samantha, the reason you need a walker, like, you know, one of those walkers for an old lady? Yeah, you're gonna need one of those. Why? Because you're literally walking like this. Your doctor's gonna recommend for you to walk like every 1 or 2 hours. Walk for a few minutes, sit down, do it again. If you're walking like this for a while, it starts to hurt back here. So if you have your little walker, you're able to walk slowly, como viejita. You're going to be walking like a viejita, but guess what? You're not adding pressure back here. For the first 2 to 3 weeks, I did use my walker. Not a whole lot, only because my recovery was in the smack middle of the summer. My surgery was July of 2023, and it was right in the middle of summer. It was super hot. You're wearing your binder, and the number one thing you don't want to do is start sweating. I wasn't really going outside for a whole lot because of that reason, only because it was really, really hot. I didn't want to start feeling sweaty, and then my incision tape, I didn't want it to get sweaty, because guess what, ladies and men, you know, men get a tummy tuck too. Guess what? You are not able to shower for the first 14 days. Yes, you heard it from me. You are not able to shower for the first 14 days, which is approximately around the time that it takes for you to take out your drain, because you will have a drain coming out of your tummy tuck. Unless you go with, there's other specialists that do the no drain tummy tuck. I have no idea how that works, but if you do have a drain, you are not able to shower until your drain comes out. You could only do like a sponge bath, like wipey bath. You get those wipies that are meant for showering. Yeah, that's what you're gonna have to do for the next, in my case, was 14 days. So viewer discretion is advised. What you are about to see is the drain bulb that you have as your drain. This is what it looks like. So there is a little bit, you'll be able to see a little bit of blood. So this right here is my little bulb that's gonna help you drain. Now your doctor, your nurse, will go over all the directions of how to drain it, how to use it, and all that good stuff. In my case, I only had one. I only had on one of my sides, one bulb. There are some doctors that do the no drain, and there are other doctors that do the 2 drains. So another viewer discretion is advised. I will be showing you of what my bruising looked like on the side. This was already like day 4 or 5. This right here is the bruising on the side. This is the other side. So I did have some bruising. It wasn't too crazy, but I was not expecting any bruising at all. That's why I'm letting you guys know that you are going to have some bruising. When you have your drain bowl, at first it will be very dark, kind of similar to the picture that I showed you. It's because it's a mixture of fluid with blood, and then with time it'll start getting lighter. By the time you take it out, it's just like a yellowish pinkish color, and it'll be a lot less. And like I said before, your doctor will go over like the amount of fluid that there is, when it's okay for you to take it out. It has like a little measuring to it. Now your drain, you're either able to take it off by yourself or go to a clinic, like an emergency clinic, or your doctor, depending who you have as a doctor, because there are doctors that are like, no, I'm not touching it if you're getting surgery. Like your primary care doctor, in my case, did not want to deal with it. They said unless the surgery was done by them, then they're able to do the aftercare. And since it was more of an elective surgery, they were not able to do any aftercare for me because of the insurance that I have. It's a private company. They were like, we're not going to do it. They didn't even want to give me the medical clearance. I did have to go more to, I went to like one of those clinics that you go to whenever you don't have insurance. They're the ones that gave me my medical clearance. And that's where I would have gone to get aftercare if I needed it. But in my case, my husband and I, we both took out my drain. Just so you know, it does not hurt. My doctor, my nurse from the surgery center, she did send a video and instructions of how to take out your drain if you wanted to do it at home. Of course, talk to your surgeon to see if that's something that he's okay with, and then do it yourself. In my case, like I said, all this information is just in my case, what it was in my case. My surgeon sent a video of how to take out the drain and what it's supposed to look like, and kind of a little bit of a description of what it was going to feel like. And basically what I read and what I saw is what happened. It does come with 2 little strings, like stitches, that are attached to your skin that you do have to like take off with some scissors, some sanitized scissors, and you have to have a gauze with you and all that. But once you take off the stitch, mine was on, it was actually on this side. You take out the stitches and pull it out. But believe me, you are not able to feel when they're pulling it out. It's not like they're pulling on something. And I mean, unless they didn't take off the stitch, it might hurt. But if they take off the stitch correctly, there is no pain to it. My husband was able to easily take it out, and it was just like a little hose that was on the inside, and he pulled it out. And since you don't really have feeling in this area of your stomach after surgery, you can't really feel it come out. At least not in my case. And what else? So my husband took it off, and you just have to let it like air dry, I guess. Let it breathe, kind of like if you have like a cut, just let it breathe. Don't cover it up. They tell you not to cover it up right away. And yeah, that was pretty much it. After you take it off, you are able to take a shower, even with the little, I mean, it's not a big ass hole, it's a tiny little hole that you're left with. You're able to shower and then just let it dry up. As far as for the incision part, you don't really do anything to that. You'll have tape that you just kind of like let fall out. It'll stay on you for weeks. If you're not messing with it, it'll stay on you for weeks. After a couple weeks, they do tell you to switch it out, because as you were able to see in one of my pictures, it was a little bloody. You take off that tape and you put in a new tape. But other than that, that's it for the first 4 to 6 weeks. And like I said before, you just have to talk to your surgeon to see exactly what week is it that they want you to take it off. In my case, I had it covered for the whole 6 weeks and then just changing it every few weeks, taking off the old one, putting right away, put in a new one, and don't let it get wet. Don't let any fluids on it, and that's pretty much it. There are some surgeons that want you to wear a faja right away and get lymphatic massages. With mine, he does not recommend lymphatic massages until 2 months after your surgery. And faja, he did not recommend wearing a faja until also around 2 months. For the first 2 months, this is what I wore. It was just a binder. I had 2 of them. The other one I threw it away. But it does get stained, either with fluids or with blood. So I do recommend having 2 of them. That way, when you're washing one, you have the other one, so you're not out of your binder that long. And basically, you just have to be wearing this for the whole 6 weeks. 6 to 8 weeks. The only thing that they do tell you is that make sure that this Velcro part is not in the middle by your belly button. It needs to be like on the side. And they recommend changing it like every few hours, like take it off, do the other side. Take it off, do the other side, every few hours. Only because they don't want these lines to be noticeable on your skin, because literally you have to keep in mind that your skin was completely taken off. It was taken off and stuck back on. So if it's gonna leave like a little crease, you don't want those little dents there. So they want you to make sure that you move this around so it doesn't leave any dents. And that's why I think my doctor recommends no fajas, because fajas are so hard in their compression that they don't want those dents or bends to stay on your skin. Get another one of these. Have 2 of these. From 1 to 8 weeks, you're going to be wearing your binder 24 hours a day, 7 days a week. The only time you're not wearing it is when you're showering. And then after, when you're able to stand up straight, which is about 6 to 8 weeks, then that's when you move into your faja. Same with your faja, you're going to be wearing it 24/7. Unless you're showering, then you take it off. At 12 weeks, that's when you're able to sleep without your faja or binder. So after your 3 months, you're able to finally, at least your sleeping hours, you don't have to wear any of it, and then just wear it during the day. Either whatever feels more comfortable for you, either just your faja or just your binder, but make sure that you always have something on. My doctor recommends wearing it for the first 6 months, but if you're able to, try to aim for the first year to have the best results, to be able to be looking snatched. And these are some of the things that I recommend having. I did purchase everything from Amazon. The arnica tea. Every night I took my arnica tea. Actually, every morning and every night, because I was told not to drink caffeine, at least for the first 2 months. So I would drink my tea every morning and then 1 every night. But I do 2 tea bags. 2 tea bags in the morning, 2 tea bags at night with my honey. Let's go over what I recommend for your scar treatment. These are the 2 that I wore. The Mederma PM Intensive Overnight Scar Cream and the Silicone Scar Sheets. Now, why did I do both? This one's expensive. This is really pricey. I can't remember the exact price, but I mean, there's only enough here for 4 uses. This one can last you a long time. It's just a tube of cream that you put on. at nighttime. I would use it after my 6 weeks. Once my tapes were off, you want to start with this one. This was less intense. This one you just wear it at nighttime, a little bit of cream, and then, you know, put on your binder or your faja, and you're good to go. None of this hurts, none of it burns, but you know, they do recommend doing like a little test on your skin, make sure you're not allergic to it. But yeah, these were the two that I would wear, and I feel like my scar looks pretty good. When you first look at your scar, when you take off your tapes, do be aware that it's gonna look a little chunky, like two skins put together. So there will be kind of like a little border, if that makes any sense. Don't be scared. With time, it does smooth out. Moment to be vulnerable again. I will show you pictures that no one has seen other than my husband and my surgeon. My before pictures. I'm so scared. My before pictures of what my skin looked like in my tummy area. Are you ready? Like I said before, viewer discretion is advised. So if you don't want your children to look at this picture, please cover up their eyes. Thank you. So this right here is my stomach area. Yup, that's what it looked like. That's all the excess skin that was taken off. My tummy tuck consists of cutting this area all the way low and taking off all of this. And for that reason, you are not able to stand up straight. In my case, 7 weeks. And this was my after. So as you can see, my incision is really low and the scar is very thin. This is my new belly button. And it looks kind of like this because I was wearing my faja. So obviously that's not there. I was wearing my binder actually, so you can see the lines. But I was left with some stretch marks in this area, but it's completely flat now. That was the tea on my tummy tuck. Cheers for a fast recovery. But yeah, I think that is it. Like I said before, if I did not cover something, let me know in the comments. If you don't want to make it public, just message me on my Instagram or my TikTok. Right there, I do read those comments and I will privately send you a message or suggestions. Okay? Thanks for watching, and do not forget to like and subscribe. Bye.